Okay, everybody, ready to get started. Thank you so much for coming to Cancer Connections this morning. This is our first Cancer Connections that we're targeting the adolescent and young adult population. So thank you so much for getting up early on a Saturday morning and braving the flurries. Yes, it is April and it is snowing, but that is springtime in Chicago, right? Well, I'm excited to introduce our first speaker. Monica Bryant is joining us from Triage Cancer, and she is a cancer rights attorney, speaker, and author dedicated to improving access to and availability of quality information on healthcare related issues. She's the chief operating officer for Triage Cancer, which is a national nonprofit organization that provides education and resources on cancer survivorship issues. So Monica, if you wanted to come up and join us, she is going to be speaking on the cost of cancer and how cancer is expensive. So here you are, Monica.
Thank you. Good morning. Are you all sufficiently caffeinated? We were just talking in the back that we think it's the weather, but it's just been hard to get going this morning. So we're going to talk a little bit about how cancer is expensive and how to deal with that fact today. Now, I only have an hour. This is something that I could spend all day talking about. So bear with me as I point you to other resources on our website or other events that are coming up where you can get more in-depth information about this. So this is kind of the overview primer for the day. And because the topic is depressing, we like to start with a cartoon. So this is a gentleman talking to his doctor's office saying, "I'm so sorry, but there's an error in my bill. You accidentally sent it to somebody with no money." And I think that a lot of us can feel like this as we're going through a medical issue or dealing with something as serious as cancer, that the bills just keep rolling in and the money isn't rolling in the same speed. So how do we deal with that? So there's a lot of factors that go into the complexity of how expensive cancer is. So oftentimes with a cancer diagnosis, there's employment changes. So maybe you can't work anymore. Maybe you need to go from full-time to part-time. Maybe you're a caregiver for somebody who's coping with cancer and that's affecting your finances, or your employment rather. Then the other reality is there's no pause button with a cancer diagnosis. We don't get to pause the rest of life and just deal with the cancer. We still have to deal with other things. So it could be moving, it could be life changes, it could be relationship changes, starting or stopping school. All of these things play into our finances. And then finally, the reality is health insurance status plays a huge role in how your finances are impacted. And having adequate health insurance can make or break you. And we're going to talk about how you get adequate health insurance. Just a show of hands, how many of you in this room are over 26? Yeah, that's what I thought. So the reality, the news and a lot of individuals that I talk to say, oh, well, the Affordable Care Act dealt with that. People can stay on their parents' insurance till they're 26. Well, as this room indicates, that doesn't solve all the problems. So before we can get into dealing with the impact that has already occurred, we have to take stock of our finances. And that can be really overwhelming and challenging when you're dealing with all of these other things. So at Triage Cancer, we joke that we are spreadsheet gurus. We have spreadsheets for everything. I know this is really hard to read, but it is in fact downloadable from our website. But we just think that it's important to get a sense of your financial big picture. And this is an easy way to do that. So here we've listed all of the property, the personal property like cars that you might own, your wedding ring, what accounts do you have, checking accounts, savings accounts, do you have any sort of investments, a retirement account, any sort of emergency fund that you might have. And then at the bottom, you have to list your liabilities. And these are your debts. So student loans, car loans, credit cards. You're going to want to put in, this is where you're going to also want to put in your medical debt. And the spreadsheet, it's an Excel spreadsheet, it will actually calculate your net worth. And it can be a little depressing to do this. It was for me. But it's a great way to keep things organized. And we also have columns for account numbers and contact information. So if you've got like an account rec at your bank, you can put all of this into this spreadsheet. It is incredibly time consuming the first time you do it, but you should only have to update it maybe once a year to keep things current. I will also say, if you have somebody who is a financial power of attorney. So if let's say you're in a situation where you go into the hospital and you're unable to make financial decisions for yourself, a document like this can be incredibly useful for them. So they're not shuffling through shoe boxes in the back of your closet trying to figure out how many bank accounts you have. So once you've taken stock of your financial big picture, and you don't have to do it in that spreadsheet, that's just one way to organize things, it's important to reassess your financial plan. So you may have had a budget and sort of a financial big picture before your cancer diagnosis, but things are probably a little bit different now. And you have to think about what your priorities are right now, and that's going to be different for every person in this room. So for some people, the priority is, I have to be brave enough to open that stack of bills that I have been shoving in the kitchen drawer. For other people, they're far enough out of treatment where the priority now is, let's start paying down some of this debt. It just depends on where you are. But some of the questions that you can start with to kind of get a sense of where you are is, did you need to take time off from work? And what's your plan moving forward? Did you have to go into a new line of work because of your treatment and side effects you might be dealing with? Do you have a stable income right now, or are you kind of living paycheck to paycheck? What are your reoccurring and potential expenses? And this can be, again, very daunting, but you have to include future medical care into this thought process. You might be thinking, well, how on earth am I going to know how expensive my future medical care is? This is a great conversation to have with your healthcare team. So if you're out of treatment and you're sort of in a maintenance phase, if you know, let's say you need a CAT scan every 6 months, look back at your old bills, figure out how much you had to pay for the CAT scan previously, and incorporate that into the future, because these bills are now part of your financial big picture. And then finally, you have to look at what unsecured and secured debt you have. So secured debt is debt that is secured by an item. So think about a home mortgage. If you stop paying your mortgage, your home gets taken away. Unlike a credit card, which is unsecured debt, where if you stop paying your credit card bill, there are certainly consequences, but you're not necessarily going to lose your home. And this concept of secured and unsecured debt we will come back to in a minute. So the next step in sort of this figuring out where you are is looking at your credit. Now, your credit score is a 3-digit number that ranges anywhere from 280 to 850. The most popular credit score is the FICO score. I'm sure you've all heard of that. And the higher your score is, the more credit-worthy you are deemed. Not only do you need to know what your credit score is, you should also know what's in your credit report, and they're two separate things. So your credit report will actually list every single debt you have. So we're talking credit cards, school loans, medical bills, anything that you have open. So the Gap card you have is going to be listed on your credit report. Why it is important to know both pieces of information is there's often mistakes on your credit report. So you may have thought you closed that Gap credit card when you graduated college, but it's still showing up on your credit report. The good news is you can ask the credit bureaus to fix any mistakes that are on your report. Now, you're entitled to 1 free credit report per year. Be very, very careful where you go to get this credit report. We've all seen the commercials with the snazzy bands on TV where they're saying you get a free credit report, but just give us your credit card number first before we give it to you. You are entitled to an actual free report, and you can go to annualcreditreport.com for that. And you're entitled to a free report from each of the 3 credit bureaus. So you can be very strategic about this. So you can ask for 1 report from Equifax in January, and then in June, ask for another report from Experian, and then in December, ask for your 3rd one from TransUnion to kind of keep it through the year and to see where things are. You can also use this information to your advantage. So negative information is allowed to be reported on your credit report for 7 years, bankruptcy information for up to 10 years. It's definitely a long time. However, you can use that information to your advantage. So let's say, for instance, you are ready to buy a car. But 6.5 years ago, you closed a credit card for less than you actually owed, and so that reported negatively on your credit. You may want to wait an additional 6 months to buy that car until that negative reporting is off your report so that you can get a better interest rate on whatever loan you might need. Now, obviously, this is a perfect situation. It might be that you need the car right now and you can't wait. But again, knowledge is power, so you can kind of make educated decisions based on this. Now, the good news is some things are changing with respect to credit reports. So FICO released FICO 9 in 2014, and the changes are really actually fantastic for this community because they're now distinguishing between medical debt and other debt when in their reporting. So it used to be debt was debt, and it would lower your credit score if you had it. Now they're taking into account the fact that people have medical debt, and it doesn't necessarily mean you haven't been responsible or you aren't credit worthy. It just means you've been hit with a serious life situation. So there's much less emphasis put on unpaid medical debt. They also won't consider debt that's paid in full anymore. So if you've had medical debt that's gone to a collections agency, but you've paid it off, that won't be considered in your credit report anymore. So good news in that regard. All right, so we've looked at our financial big picture. We know what's on our credit report. We know what our credit score is. The next step is creating a budget. This is probably the most simplistic thing that I can say that is actually really challenging. It's hard to create a budget, but you're gonna wanna really look at all of the pieces of your financial picture. So all the wages that you have, any sort of other earnings, interest from bank accounts, child support, alimony, and then you have to include all your expenses. And it's important not just to look at the expenses that you think you should have, like rent and gas bills. What are your actual expenses? Do you have a Starbucks habit? That needs to be included in your budget. Do you go see a movie every single Friday? That needs to be included in your budget. And that stuff's okay. It just has to be incorporated. Certainly, this is something that you can do on your own, but I suggest not reinventing the wheel. There are thousands of free templates available online if you just Google budget templates. There's also software like Quicken has a software program that you can buy for like $60, and it asks you a bunch of questions and you plug in your information and out pops a budget for you. But a lot of us are overwhelmed by this and feel like this couple who's sitting at their kitchen table saying, well, we can pay off our past and save for our future as long as we avoid the present. And it's true. It can be really, really daunting. You think you have all these big plans. Great, I'm going to pay down all these credit cards, but I can only afford to eat top ramen for 6 months. If you're one of those people that's overwhelmed by this, consider talking to a financial planner. There's a misconception that financial planners are really only for people who have like Bill Gates kind of money. It's not true. In fact, if you've got Bill Gates kind of money, you probably don't need a financial planner, right? It's really for the person that's trying to get back up on their feet, trying to figure out dealing with any sort of debt that they might have and planning for the future. So the Financial Planning Association has a part on their website where you can plug in your zip code and it will pop out certified financial planners in your area. A lot of them will actually have a consult with you for free and will only charge you if you decide to sign a contract and move forward with them. There are also consumer credit counseling agencies in almost every county in Illinois, and they have free budget templates. They've got financial planners that you can talk to. They can counsel you if you're considering bankruptcy. But just be aware that a lot of credit counseling agencies will suggest things like debt solutions to reduce your debt. So for example, if you've got a $10,000 credit card bill, they might negotiate you only have to pay $3,000, close that credit card. But what people don't always realize is that might really negatively affect your credit score. So if you're in a situation where you might be looking for a new job, maybe you don't want to take that hit on your credit right now, because a lot of employers will do credit checks and will make decisions about your trustworthiness based on that number. So sometimes great solutions just sort of depends on where you are in your life. And then the biggest part of this financial hit that cancer usually throws is medical bills. There's no way to avoid them completely, but certainly one way to lessen their impact is by having adequate insurance. And it seems so simple, but we know that prior to the Affordable Care Act, 78% of all of the bankruptcies that were filed in the United States were due to medical debt. And of those people, over 60% of them had health insurance. So it goes to show that prior to the Affordable Care Act, just having health insurance wasn't enough. The Affordable Care Act has done some great things to make it easier, but we still have to be smart consumers. One of the biggest problems that I see, especially in the young adult community, is not really understanding their health insurance policies. How many of you feel like you understand how health insurance works? Yeah, don't be surprised. I do this all over the country, and that is usually the response that I get. So starting from the beginning, your premium is what you pay every single month just to have health insurance, and you're going to pay that amount whether or not you access care. Then there are some costs that you're only going to pay if you access your care. The first is your deductible. This is going to depend on the plan. Some plans have a $0 deductible, some have a $6,000 deductible. But your deductible is the amount that you have to pay out of pocket before your health insurance company will start picking up their share of the costs. Your copayment is, again, going to depend on the policy that you have, but it's the cost that you have to pay before they even let you in the door. So a lot of policies have like a $25 copay to go see the doctor, and you have to pay that every time you go and see the doctor. Finally, your coinsurance or cost share. And this is the difference between what your health insurance company is responsible for paying and what you're responsible for paying once you hit that deductible. So if you have an 80-20 plan, once you hit your deductible, your insurance company pays 80% and you pay 20%. And then finally, your out-of-pocket maximum is going to include your deductible, any co-payments you make, and any payments you make towards your coinsurance. So it's everything except that monthly premium. Now, with the Affordable Care Act, some good things have happened. So it's really limited what insurance companies are allowed to do in terms of canceling somebody's policy once they get sick, or placing limits on the amount that they're going to pay out for your care. So it's much easier now to find adequate health insurance because thanks to these rules now, your health insurance should be there when you need it. As I mentioned earlier, young adults can now stay on their parents' policy until they're 26. And insurance companies are required to pay for the routine costs associated with clinical trials. This is really, really important because we're seeing how important clinical trials are to cancer care. And participating in a clinical trial might be a really great way to not only get great care, but to lessen the financial impact of cancer care. What was happening before was insurance companies were saying, oh, you're in a clinical trial, we're not responsible for anything. Now, insurance companies have to pay what they would have paid if you weren't in the clinical trial. So let's say your routine care was you get 2 mammograms a year, but the clinical trial wants you to have 12. The insurance company still has to pay for those 2 that you would have gotten no matter what, and then the clinical trial will generally pick up the other 10. Another really important thing that the Affordable Care Act did was it made sure that preventative care was covered for free. So certain preventative services are going to be covered at 100%, even if you haven't met your deductible yet in the year, and you can't be charged a copay for these services. You can see the entire list at healthcare.gov, but it really does cover quite a bit of things that people weren't avoiding getting because they had to meet a high deductible before they could go get these services. Now, 2 of the most important things, in my opinion, that the Affordable Care Act did was it said that insurance companies can now only look at 4 things to determine somebody's premium. Remember what you're going to pay monthly. Is somebody buying an individual plan or a family plan? Family plans are going to be more expensive. Your geographic location, your age. So yes, it is more expensive the older you get, but there's still limits on how much more expensive it can be. And finally, if you use tobacco in any form. Those are the only 4 things. So what don't you see here? Pre-existing conditions. The other thing that you don't see here affects about 80% of the room. Gender. So prior to the Affordable Care Act, women were charged a substantially higher amount for the exact same health insurance policy as men. So this provision really starts to level the playing field in terms of somebody's ability to purchase health insurance. Which leads me to my second point, which I think is the best thing that the Affordable Care Act did, and it said that insurance companies can no longer deny someone based on a pre-existing condition. And I realize you've probably heard this before, and it's maybe a little bit of old hat by now. But if anybody was diagnosed prior to 2014, I hope you recognize the importance of this provision. My colleagues and I used to spend hundreds, if not thousands of hours trying to help people figure out what they were going to do for health insurance once they had a pre-existing condition. And a lot of times it meant things like losing their home so they could pay for care. Hopefully that will no longer be the case. Okay, so in exchange for all of these new benefits and protections that we have, there's one requirement: we have to have health insurance. For most of us, nothing will change because employer plans, individual plans, COBRA, HIPAA, Medicaid, Medicare, high-risk pools, veterans, all of these things are health insurance. If you don't have one of these things and you don't fall into one of a number of exceptions, you'll have to pay a penalty. This year, the penalty is $695 or 2.5% of your household income, whichever is more. Now, there are some exceptions. You can have one gap of up to 3 months in coverage. Please keep in mind, though, that although if you have this 3-month gap, you won't have to pay the penalty, you don't have health insurance. So if you need any care in these 3 months, you're paying for it 100% out of pocket. So we definitely don't recommend having this gap in coverage, but it is important to know that if you do, you won't be charged the penalty. There are also some exceptions for financial hardship, and originally that just meant if the cheapest plan you could buy was more than 8% of your household income. Well, the advocacy community went back to Health and Human Services and said, really, that's not enough. You're really not kind of including everybody that might need an exception. So Health and Human Services expanded their exception and created all these new categories. So you filed for bankruptcy, you had medical expenses you couldn't pay in the last 24 months, and it goes on. My point here is to demonstrate that this individual responsibility clause was really not meant to kick people while they were down, but it was really to try to incentivize people to purchase insurance because we know 2 things. 1, individuals' health status improves when they have health insurance. And 2, in order for this system to work, we need everyone to buy into the pool, the healthiest of the healthy and the sickest of the sick. So the Affordable Care Act also gave us 2 new health insurance options. The first is an expansion of Medicaid. So it used to be that you had to have a low income and asset level and fall into another category, like be a minor child or have a disability. So that left a lot of people who just had low incomes without an option for health insurance. The Affordable Care Act expanded Medicaid to anyone who has a income at or below 138% of the federal poverty level. So this year we're talking about someone who makes less than $16,000 a year. The Supreme Court got involved and essentially made this provision voluntary for states, so we have kind of a hodgepodge of things happening. Illinois has expanded, although there's always the possibility that that could change depending on who is elected in the future. The second new option is the health insurance marketplace. Now, there's a lot of confusion about these marketplaces People think it's government insurance. It absolutely drives me up the wall when people say I have an Obamacare plan. There's no such thing. Because what these marketplaces are doing is they're selling you private health insurance policies. So Blue Cross Blue Shield, Aetna, Humana, all the same health insurance that's been available to us in the past. But the marketplaces have just organized it for us. So we think of it as like Amazon for health insurance or a health insurance shopping mall. So just like when you go into a mall and you buy a sweater from the Gap, you're not buying a mall sweater, you bought a Gap sweater. Similar concept here, and it's really important to remember because we have some power as consumers. In addition to organizing the information in a better way, there's some quality control involved. So health insurance companies have to apply to sell their policies in the marketplace. And they have to meet some minimum standards in order to sell. So you know that if you purchase in the marketplace, you're at least getting, this level of quality of care. If you buy from outside the marketplace, you really have no idea. Additionally, there are some financial assistance options available if you buy in the marketplace. And there's two different kinds of financial assistance options. The first is a premium tax credit. And so this is going to be a credit that reduces the amount that you pay monthly for health insurance. The second is a cost-sharing subsidy. And so this is going to reduce things like your deductible or your copay. It's all based on your household size and income level. And so this is how it all kind of shakes out in Illinois since we've expanded Medicaid. So if you have an income at or below 138% of the federal poverty level, you'll be eligible for Medicaid. If you have an income between 138 and 250% of the federal poverty level, and you choose to buy a silver plan, which I'll talk about in a minute, you'll be eligible for those cost-sharing subsidies. And then if you have an income between 138 and 400% of the federal poverty level, you'll be eligible for premium tax credits. So there are some people that are going to be eligible for both cost-sharing subsidies and tax credits. So the way the tax credit would work is if you have an income over 400% of the federal poverty level, your premium's $242 a month. If the same person had an income at 300% of the federal poverty level, they would get a tax credit that would reduce what they had to pay monthly to $103. And so on, if they had an income of 250% of the federal poverty level, they would only have to pay $40. So does that make sense how the credits work? Okay. States had an option of what they were going to do. Some states created their own marketplace. Some states said, we want nothing to do with this. We'll let the federal government create their marketplace. And somehow kind of a hybrid partnership. And that's where Illinois is. So we have an Illinois marketplace. If you go to the marketplace website, and you want to apply for insurance, it'll actually kick you into healthcare.gov to do the application because we have this partnership. For all intents and purposes, it really doesn't matter because what you're purchasing is still private insurance being sold in the state of Illinois. So it's Land of Lincoln or Blue Cross Blue Shield or Humana. Now, one of the interesting things that the marketplace did was it standardized the types of plans you could buy based on cost share. So remember, cost share is the difference between what your insurance company pays and what you pay for your care. So the bronze plan is the lowest level, and it covers 60% of your healthcare costs, and you're responsible for 40%. And it goes up by 10. Silver, gold, platinum is a 90%, 10% plan. Generally speaking, bronze plans will have the lowest monthly premium, but the highest out-of-pocket maximum. Platinum plans will be the most expensive monthly, but have the lowest out-of-pocket maximums. For 2016, the highest out-of-pocket maximum for an individual is going to be $6,850. Now, I certainly am not standing up here saying that $6,000 is anything to sneeze at. However, if you think about how much your care actually costs, if you've ever looked at the bills, $6,000 is a drop in the bucket. So what's great about knowing this is that at the beginning of the year, you can actually sort of plan out and budget and say, well, I know I'm gonna, have X amount of scans and it's gonna cost however much it costs, but I'm only gonna be responsible for $6,850 of it. Okay, now, one of the things that I see this population falling into the trap of all the time is when they're picking their health insurance policy, they only look at the monthly premium. And this is true if somebody is buying in the marketplace or if they're choosing between, two employer-sponsored plans. The same principles apply. So if you look at the top plan here, it's a bronze plan, and the monthly premium is $105, but the deductible is $5,250. Which means you have to pay $5,250 out of pocket before your plan will start to pick up their share of the costs. The gold plan is $197, but look at the deductible. $0. So your plan starts picking up 80% right away. And then finally, the platinum plan, which is $279 a month, but the deductible is $1,000. So how can you, looking at these numbers, figure out which is the most affordable plan? How many of you think it's the bronze plan? Good, no one fell into that trap. How many of you think it's the gold plan? Some of you. How many of you think it's the platinum plan? Oh, it's like you've seen this presentation before. The way that you figure this out is you take the monthly premium and you multiply it by 12 to figure out how much you're going to pay for the year. Then you add the out-of-pocket maximum. And you then figure out how much the plan is going to actually cost you for the year. And as you can see, the cheapest plan is in fact the platinum plan. So this calculation doesn't necessarily work for everybody, because if somebody was just a healthy 27-year-old, maybe they're not going to see the doctor very much in the year, and so paying the least amount monthly makes the most sense. For anybody who has any sort of history of cancer in their family, a bronze plan is not the best idea. The reason for that, too, is that there's differences in the plan, not just cost. So most of the platinum plans have wider networks, they have better prescription drug formularies, they have other benefits, sometimes including vision and dental. So really, I'm not saying the platinum plan is for everybody, but please do this math to figure out what the plan's actually going to cost you. Some other ways to make the most of your insurance include using in-network providers, paying attention to bills. I can't tell you how many mistakes I've personally seen on medical bills. And it's not for any malicious intent, but who's doing the billing? Humans. And what do humans do? Make mistakes. So it's really up to us to check these bills to make sure that you've actually received what you're being charged for. And then finally, leverage your out-of-pocket maximums to the extent possible. So if you look at this example, your plan has a $2,000 deductible, 80-20 plan. Your out-of-pocket max is $4,000. You've had surgery, you have a $102,000 hospital bill. What do you actually pay? You pay your first $2,000 for your deductible, so you have a $100,000 bill left. Then you have to pay 20%, because that's your cost share. That leaves you with $20,000. But thankfully, you have that $4,000 out-of-pocket max, so you're only responsible for paying an additional $2,000. So if you're in a situation where you've already hit your out-of-pocket max and it's April 2nd, be smart about it. Are there other things that you need to go see the doctor for? Is this your family out-of-pocket max? Because if that's the case, then maybe your husband or kids should all go get their checkups and everything else they need to have done as well. So it can be really smart to kind of, and I'm certainly not suggesting you go get care you don't need, but most of us put off seeing the doctor for other things and kind of only deal with the really important stuff first. But you can save your family thousands of dollars if you understand how this works and you use it to your advantage. Also, you don't necessarily have to take no for an answer. Every single insurance company has an internal appeals process, and thanks to the Affordable Care Act, every state now has an external appeals process that you can go through. And we have more information about all of this on our website, including an appeals tracking form that you can print out and use to kind of help you walk through this appeals process. And then I've included a bunch of slides at the end of this that I wasn't planning on talking through because really you can kind of read through them and make sense of for yourself. They have access to the slides, right? Yeah. They'll have access to slides? Okay, great. But a couple things that I did want to mention was to keep track of this information. So medical bills, to keep track of any pre-authorizations you may have gotten, but also to keep track of things like travel expenses, meals you've had while you're at the hospital, lodging, maybe you've had to travel somewhere else for care, because some of those can be deductible on your taxes. So you need to keep this information for a minimum of 3 years, but I've also heard some CPAs suggest 6 years if you do deduct this stuff on your taxes, just in case you get audited. And then finally, we didn't talk a lot about employment today based on time, but in a couple of days, actually next Friday, Cancer and Careers, which is another nonprofit that Triage Cancer works with extensively, is hosting a free conference here in Chicago. It's an all-day conference, and we do nothing but talk about employment and finances and health insurance. And it's a really great conference. It's in its 3rd year. If you're available on Friday, I really recommend that you come down. We talk about job searching tools, if you're looking for that. We talk about reasonable accommodations to help you work through treatment or dealing with side effects. You can also find this on our website as well, in addition to the Cancer and Careers website. But I definitely recommend it if you have any questions about work and cancer. And with that, questions? Good question. I think it's like 8 to 4:30. So this is how you can connect with Triage Cancer. Again, we have a ton of information on our website. It's all free to download. We have free webinars where we spend a lot of time drilling down on these topics. And then the webinars are all recorded on our website as well, so you can watch them later. So I'm happy to take questions until they tell me I'm done.
You have about 5 minutes for questions.
Look at that, 5 minutes. Any questions? I'm sorry? BRCA is the BRCA gene, and it's the gene and I'm the wrong person to be talking about this because I'm not the doctor, but it's the gene where if there's mutations, you can be more likely to be diagnosed with breast cancer. So, yes. So there's still some issues with it because the original law said that it was only BRCA counseling, it was only genetic counseling that was going to be covered. Health and Human Services came back and said, no, it should be counseling and the testing, but there's still some issues with the insurance companies denying it. But that's one of those places where you should A, appeal it with your insurance company, or B, talk to your lab that you've gotten the lab work done, because a lot of them are now doing things like that. So again, I'm the lawyer and not the doctor, so I don't feel comfortable answering that question. I'm going to let someone else answer that question. Yes.
One thing that you didn't mention that I'm curious on your take on is in-network versus out-of-network decisions.
Okay.
And how that all kind of plays into insurance coverage and wanting to make sure you have the best medical expertise.
Did everyone hear the question in the back? So the question was about in-network versus out-of-network and how that all works with insurance coverage. And it's a great question. So most plans, and it is definitely plan specific, but most plans have a cost share for in-network providers and then a cost share for out-of-network providers. Usually with the out-of-network providers, they cover substantially less than they would with an in-network provider. Additionally, any payments made to an out-of-network provider may not count towards your out-of-pocket maximum. So when I talked about leveraging your insurance plans, one of the things I said was using in-network providers, and that's exactly the reason. So to make sure that the insurance company is paying the highest amount that they can, and that any costs you're paying are going towards that out-of-pocket network. So when you're shopping for the plans, and I didn't spend a lot of time talking about this, but when you're shopping for the plans, it's not just the finances that you want to look at, but you have to look at, if you have an oncologist at Northwestern, you want to make sure you pick a plan where Northwestern and that specific oncologist is in network in the plan. Otherwise, you're not getting adequate insurance for you, and you can end up with huge bills. It's a little trickier, obviously, if you're in like mid-year and you get diagnosed and you can't make those decisions, but it is something that you can think about come open enrollment next year. Okay, I've just been told time is up.
Well,
one more question. Yeah?
Oh, no, I was just going to say, self-information they had. I was assigned a case manager when I was diagnosed,
Mm-hmm.
and I have Cigna, and they created some program called My Champions, and I was allowed to see out-of-network providers at the in-network rate.
That's great.
So, and they said that, yeah, you just have to call your insurance company and say, because I couldn't, I mean, if I had someone who's not in network, analyzing my blood tests, that's not fair. I'm not picking that person. Right. So that's why they created that program. So other insurances might have that.
So that's great to know about Cigna. It's definitely the exception and not the norm.
Yeah.
So you have to be careful. And a lot of times where people run into problems with this is, for example, if they've had surgery, their surgeon and the hospital might be in network, but maybe the anesthesiologist that they didn't meet until they were being wheeled into the operating room is out of network. The advocacy community is doing a lot to try to stem that, because you shouldn't be saddled with this huge bill for not knowing, but it's still something that legislatively we need to fix as part of it. But that's a great sort of suggestion, is to ask the insurance company if they have anything like that. A lot of them do have case managers now. I will just sort of warn that remember who those case managers work for. They still work for the insurance companies, and the insurance companies are not altruistic entities. They are businesses, and they are trying to make the most money that they can. And so certainly a worthy resource and not one that you should shun, but just kind of keep that in the back of your mind and kind of double check everything that you're being told. So, well, thank you so much. It was a pleasure to be here. Okay.